I hope you are having an amazing day. Let me know if you can hear me. All right. Hello, everybody. Welcome in. Hey, can you hear me okay? I'm trying to add a question. Hey, I hope you're having an amazing day. Hi. I've been trying to get to you all day. It has been a very busy day, so I hope you're having an amazing day. It's a pleasure to see you all. Put those questions, whatever you have in the chat. My class starts in like 10 minutes, so I'm trying to get on here and just say hey to you all because I missed y'all. I'm gonna do a video tomorrow, so hopefully I can see you all then. But what questions do you have for me today? Go ahead and put those into the chat. All right, and so while you're waiting for that, what is the medical term for involuntary loss of bladder or bowel control? Let's see if you know your terminology. I'm covering up the answer so you all cannot see the answer. Madura, yes, it's been a very busy day. This month has been busy, but thank you for making time to just join with me. And so, what is the medical term for the involuntary loss of bladder or bowel control? Yes, Marcia, it is incontinence. Great job, great job. Let's see if anyone else chimes in also. It says the medical doctor training. No, we just train good healthcare professionals, but let's see. Does anyone have a test scheduled? Close. I'm sorry, it's so loud out there. It's not continental, it's incontinence. And so the way that you as a nursing assistant, so there's different levels. The way that a nursing assistant would handle incontinence, the number one answer would be to take the resident or the patient to the bathroom more frequently. If they're unable to get up, you'd offer them the bedpan. And so that's usually always going to be the test answer. If it mentions anything about limiting fluid, putting in a catheter, those are the incorrect responses, because limiting fluid without a doctor's order could be neglect, and only nurses insert catheters, and we have to have a doctor's order for that, because anytime we insert something into someone's body, it increases their chance of getting an infection. So the best answer for your test and in the real world would be to take them to the bathroom more frequently. So yes, I'm happy that you're here, Prayer World. All right, let's see if I can get you another question. Let's see. What does the medical abbreviation NPO stand for? Yes, sir. You can come on. No, you're fine.
We're done.
Okay.
We do have to come back, I guess, whenever they patch the sheetrock, we'll come back and patch the floor
Okay.
down there. I'll put everything back in the room for you.
Thank you.
It's a pleasure.
I appreciate you. I'll make sure I give you a 5-star review.
Thank you, ma'am.
You're
You
welcome.
want to lock this back door, or you just want me to lock it down on the bottom?
If you lock it on the bottom, I'll lock the top.
Yeah,
All right, so sorry about that, you all. You have a good day also. We had some construction, some work going on in our office. So what does the medical abbreviation NPO stand for? Marcia, you got it. Nothing by mouth. So why would a patient have an NPO status? So it's one thing to read it, but I need you to understand the reasons why. Why would a patient not be able to have anything to eat or drink? And I know you want to see the options, but can you see them now? Okay, I'm back. Thank you so much, it's T. Thank you. All right, so why would a patient have an NPO status? What do you think? All right, give me at least 2 answers. Why would your patient be NPO? Yes, surgery, and then, man, I'm so proud of y'all. Look at these nurse tears. So they could have a surgery, they could have a procedure, and of course, we don't want them to have any anesthesia with something on their stomach. So that would be a reason for them to have an NPO status. Or right now, maybe it's not safe for them to eat or drink because they've been aspirating and the speech therapist hasn't come in to evaluate them to tell us, the medical staff, the best type of diet for that person. And so that was right. I am so proud of you. Let's see. God bless you for what you are doing. Thank you so much. And I'm blessed to have you all too. When I tell you that when I don't see you all for a few days, it's like I miss my family. I'm like, hold up, I haven't been online. So I'm trying to get here. All right, let's give you another question. And while I'm asking you all questions, yes, G-tubes and tube feedings. So some people who have a tube feeding, they can still eat, but it's more so for pleasure, because maybe they have a stricture, so it's not like they can eat like you and I eat enough to maintain their nutritional status. So every now and then you're going to see somebody who has a gastric tube who is also able to eat small amounts, but that's just for pleasure, not necessarily for nutritional. All right, let's go to the next one. Let's give you a new one. Oh, this one's easy. Let me move out the camera. There. What does the medical abbreviation STAT stand for? Is it A, as soon as possible, B, immediately, or C, standard procedure? We're working together. And I say, I need you to go to the blood bank STAT to go get that blood. What does that mean? That's right, immediately. That's an emergency. So what are STAT orders? That means that this patient is critical, the doctors come in, and we need to get things done right away. So you as a CNA, you may get STAT vital signs. Maybe if your facility allows a STAT blood glucose level, what you'd be doing the finger prick to get their sugars. Not all facilities allow that. A lot of times you do STAT running. I'd be like, go get the crash cart, go get this, go get some IV fluid. So move fast, because our patient is at risk of, maybe having a serious medical condition if they're not already experiencing it. So let's see if I missed any questions. You're so welcome. All right, don't look like I've missed any questions. All right, so this now is the easiest way for me to get on and do practice questions with you, because when I do the vertical videos, those take hours to create, and this one's just a few slides. So I can get in, see you all, and test you out. What does the medical abbreviation PRN stand for? A, as needed, B, twice a day, or C, before meals? What do you think? What does PRN stand for? We have some A's, we have some B's, we have a C. So PRN, don't ask me for the Latin term, is as needed. So you'll hear that a lot with medications. Like we'll say a patient has a PRN medication for pain. So that means that they would only get that based upon when they experience pain. So PRN. We'll also tell you to turn your patient every 2 hours and PRN as needed. Because what if your patient's complaining of pain before 2 hours? You're not going to leave them in that spot. All right, let's go to the next one. When counting respirations for a patient with known sleep apnea, what is a critical observation to make? A, note pauses or shallow breaths. B, count only during deep breaths. C, measure for exactly 15 seconds. So when your patient has sleep apnea, you're gonna know it, because it's gonna be like, and then they stop breathing you're like, please breathe again, please breathe again. So they can stop breathing for sometimes 10 seconds. So whenever someone has an irregular breathing pattern, what do you want to do? All right, waiting for some more responses. For everybody who put A, you have it. And whenever something's irregular, and for your test, you have to count those respirations, the pulse for 1 full minute. I know what you do in the real world. You want to count it for 15 seconds, and whatever number you obtain, multiply that by 4. You cannot do that during your CNA examination. Sharon says, you guys are too smart and too quick. They've been watching my videos for a while, Sharon. All right, so let's go ahead and go to the next one. That can't be all of them. I know I did more. Oh, well, that sucks. All right, so anyway, let's just talk because my students haven't arrived yet. What questions do you all have for me? Put them in the chat. Anyone have a CNA test coming up? Are you in nursing school? What's going on with you? Oh, you guys and gals are quiet today. This the after work crew. The morning crew be yapping. Any questions that you have for me? And I am surprised that I don't have more questions in here. All right, so I'll just ask you a question. Can you yell? Not if I don't know what that means. I'm old school. I just don't say stuff just to say it. So whatever that means, I don't know what it means. It's not medical to me, so no, I can't say it. Metabolic acid, I love that. So now that is so long and involved. And for this video, it's more CNA. Would you like for me to do a video on metabolic acidosis? So when we talk about pH balances, it's a little bit too much to be talking about like right now because I have a class starting, but I think that's a good suggestion. Are you in nursing school? All right, so let's go here. All right, metabolic acidosis, I just joined. I need your help. I need this so badly. We have all those videos, so make sure you go back and you look at our medical terminology videos. A lot of times when you're taking your written test, you're not answering the questions correctly because you don't understand the terminology. So even though it's just me talking, but you know, you're listening to these rationales, most of the students pass their CNA examinations because they're listening, and you get to listen from the comfort of your home. So it's not like you're in a classroom setting with, you know, classmates and you can be distracted. So learn the medical terminology, listen to the practice questions, and if you need help with your skills, we even have videos on that also. But pace yourself. What I recommend doing is maybe 25 questions per night and 3 skills per night. So if you can do that, and if you do that like maybe 5 nights per week, your test is in 30 days. And you do 25 questions and 3 skills every night. By the time you take your test, there's not a question they can ask you that you don't already understand. There's not a skill they can show you or have you perform that you haven't already performed multiple times. So I know you're gonna do well, you just gotta get to practicing. What's a good way to practice telephone screening for HOSHA? Tell me what HOSHA means, because I have no idea what that is. All right, so if you all are putting acronyms in, just help me help you and let me know what that means. Let's see. It means I need CPR. You don't need CPR because you're chatting with me. I am thinking about a change in career and I love your presentation. Yes, medical, you know, and you don't have to do nursing. CNA is the entry. CNA, nursing assistant, that's the person who works under the nurse. You can work in home care, you can work in hospitals, you can work in jails, Department of Corrections, you can work in nursing homes, and you can even work with kids. So it gets you in the door so you can figure out where you want to go to from there. Radiology, sonography, maybe you want to do cardiovascular tech. So you could do speech therapy, physical therapy, nursing. So at least you get to get in, and a lot of these facilities have tuition reimbursement. So once you get in and you're employed, well, then you can kind of figure out where you want to go from there. Because I understand not everybody wants to be a nurse. All right, so let's see what else. Tired and sore from the gym. I hope you exercise for me. Seasonal depression is real. It's cold in Florida. I don't do anything except for go to work and go home. But I'm proud of you for working out. I'm going to mute you if you keep having me try to say something and I don't know what it means. So somebody fact check that for me. It's like a healthcare organization that has events like medical assisting HOSHA at schools. All right, so let me go back and look at your question. What's a good way to practice telephone screenings? So when you say telephone screenings, is it like you being a healthcare provider talking to a patient and trying to get their medical history? Because that's what I'm thinking you're talking about. All right, so I'll be waiting for your response. All right, thank you so much for your online videos. I passed my exam. Proud of you on the first attempt. From Miami, please give us a 5-star review. Go to Google, go to Facebook, Florida Training Academy. We just had another young lady who actually traveled here for our hands-on class, and she is from, I want to say Fort Lauderdale, and she just called me today to tell me that she passed her exam. So I'm so proud of my babies from all over the world, but you know I got a special place in my heart for people from Florida. All right, let's go to the next one. All right, so put those questions in the chat. Tomorrow's video is more than likely going to be on CPR, because the American Heart Association changed their guidelines. Did you know that now we don't use 2 fingers on the infant anymore? So if an infant is in cardiac arrest, the 2-finger technique is no longer allowed. You can do the 2-thumb encircling hand technique. You can also use the palm of your hand. But the 2 fingers, we have until the end of February to change the curriculum. So if you take a CPR class between then and now, somebody could still have that old video. But going forth, 2 fingers on the infant, no more. Something else they changed, everybody, is if you have a choking adult, you can do back blows now. All these years they said don't do back blows because you can make the object go down. Well, now research has indicated that it's going to be a mix. It's going to be 5 back blows and then 5 chest thrusts, abdominal thrusts. And that would be for an adult patient who's choking. Help me out, you all. If there is somebody who's wheelchair bound and they are choking, so imagine me, a patient who's in a wheelchair, and I start choking. Where would you place your hands? On my stomach or on my chest? So chest thrust or abdominal thrust, which do you think? I got you, I see it there, okay. So you gotta think about this. You're taking care of a patient who's wheelchair bound, and now they're showing you the universal choking sign. Where do you put your hands? Abdominal thrust or chest thrust? Remember, the wheelchair has a back, it has arms. So I see you all putting abdominal. Let me show you the new technique. It's been a technique for a while. It's the same technique we use for somebody who's pregnant or somebody who is overweight and you can't get your hands around them. We're gonna go to the chest, you all. So where the chest thins out at, not where the cleavage is, directly above it. You're gonna make a fist, tuck your thumb. Everybody do it with me. Make a fist and tuck your thumb. Take that thumb to the flat part of the chest where the cleavage, where it separates. Put one hand on top of it, and you don't go up like a abdominal thrust. You go straight in. You go straight in. So if someone's pregnant and they're choking, if they're obese and you can't get your hands around their stomach, you go under their arms here and go straight in. That's also the technique you're going to use for somebody who is wheelchair bound, because it's going to be hard for you to get to their stomach with the whole wheelchair back there. All right, so let's see. I missed a question. Missed a couple of them. Thank you all for your patience. All right, so let's practice right now. I hope you have pen and paper available. She wants to know how to do like a patient intake. So I'm going to be the nurse and you're going to be the patient. So hello, organization who's doing the intake. This is Shannon speaking. How can I help you? Well, Shannon, I have an appointment tomorrow with Dr. Such and Such, and I was told to call in to complete my pre-op paperwork. May I have your name and date of birth? That's how we're going to start off, because we have to identify them. Can you verify the physician and what procedure you're having? And you're going to have like a list of information. Can you tell me about your medical history? What medications are you taking? Do you have any allergies? So a good thing to think of is sample. And sample is how we do our assessments, our histories. So the S stands for signs and symptoms. Are you experiencing any pain right now? Well, yeah, my back hurts really bad. On a scale of 0 to 10, with 10 being the worst pain you ever felt in your life, how bad is your pain level right now? So S, signs and symptoms. Now they're coming in, you all be fast. A is allergies. What are you allergic to? Any food or any drink? They're gonna be loud. We get loud here. Hey y'all. M, what medications are you taking? Come say hey to your class. I'm online. She's not gonna come say hey. P is past medical history. L would be like last meal. Well, when was the last time you ate something? Because let's say that surgery is the same day or in a few hours. They're usually going to be NPO after midnight. And then E would be any events that led up to it. But usually if you go online, you can find like a whole sheet. So I want you to do like sample patient history and then try to find a PDF so that you can be practicing. And then don't forget that you're going to have to get their insurance information or their method of payment. You're also going to have to get information about their emergency contacts. And that is a good way to start. That was a lot of information. So sample, insurance, because they got to get paid. And then who's taking you, who's going to be, bringing you to the facility, who's going to be picking you up, who's going to stay with you, who do we contact if there's an emergency. So I hope that answered your question. All right, let's see what else I missed. All right, let me know if that helped you, Joy. All right, do you have books that I can purchase online? I'm from Uganda. So yes, we have a CNA book that you can purchase online. It's on Amazon. It's also on our website. So if you go to our website, which is fltraining.com, which is Florida Training Academy, Amazon would be able to ship it to you worldwide. So thank you all for considering purchasing our book. Good evening, Miss Eunice. My exam is next week. Can you help me, please, with the care plan? Oh, it's gonna be hard for me to find you a care plan. I need you to email me. So I'm assuming you're a nursing student because CNAs usually don't get tested on care plans. So I need you to email us at admin, ADMIN, at fltraining.com. I want you to let me know specifically what help you need because usually your teachers, they provide you with sample care plans, etc. And then your nursing school book should have care plans in it. So let me know what help you need with a care plan and I'll try to get it to you. I just know that this weekend I'm gonna be super busy. All right. You're so welcome. Guess what, everybody? It's time for us to get ready for our CNA class. Yep, we have night classes. So I love you all. Tomorrow's video will be on CPR. I hope you're able to join us. And if not, you always can watch the rebroadcast. We love you. We're so proud of you. And we'll see you in the next video. Bye, everybody.